So my name's Bronwyn Struthers and I'm the Head of Health, Safety and Wellbeing for Watercare.
Hi, my name's Duane and I'm the Health and Safety Manager for the GAJV, Central Interceptor project. GAJV is a joint venture between Gela from Italy and Abergele from Australia that are delivering the Central Interceptor for Watercare. We're currently building a wastewater tunnel facility from Mangere through to the city to help with the backload of wastewater and also stormwater in the event of high rainfall. So it's a 4.5 internal diameter tunnel that ends up at the Mangere treatment plant with a rising main and linked into the existing wastewater treatment plant. So level 3, when we were placed in level 3, we started the process of working out what level 4 would look like, and with a big aim to start making sure the sites are ready to be shut down for a duration of time, ready for security. We worked with Watercare to ensure that we had a garrison or a security, as well as workers that are on call on site in the event that something did happen, so we could actually work with it straight away, especially out of the wastewater treatment plant, because we're sharing fences, we're neighbours out there. So if fences were to come down, if we did have machines, we did have flooding, we had adequate people on site 24/7 to fix the problems and mend them as required. This also enabled us to do a shift report both day and night and inspections from traffic management, environmental, community and health and safety. So education for our staff, what did it look like? What is COVID, the lockdown going to be? Where can we work from home? How are we going to work from home safely? We took in a large consideration for the wellbeing of our workers, discussion with the workers to make sure they still had the same amount of support that they did whilst at work. We put programs in place where we had our occupational nurses contact regularly the workers in the field. We had competitions from colouring in all the way through to cooking, like I see on most television shows. And we also had a very big support from the HR department, just doing some general health checks and checking in. But for the safety and wellbeing side of things, it enabled us to start getting together and saying, what is this going to do? How is it going to affect us? And more importantly, what do we need to do with the guidance from CHASNZ and other organisations about coming out at the other end? And come up with the COVID-19 management plan, which consisted of medical checks for everyone that's coming back on board. And that was done by our occupational nurses with the vulnerable people. And we looked at the site facilities. We looked at training, our induction process to make sure our induction process can still continue under level 3. We looked at the return to work, who can actually come back to work in the office as well as out in sites. We worked out who could actually remain at home and still do their job successfully. And then we worked heavily with our suppliers, subcontractors, and our consultants to see if they're ready to come back as well and see what they're all actually doing. Once we got the go-ahead, we got the level 3, we were able to start on site at 7 o'clock on the morning of release. We arranged with Watercare our first day back, which was 2 4-hour sessions. One was out at Mangere and the other one was out at May Road. We engaged, we had senior leadership talks. We've placed all of our workers in fresh overalls every day. So the JV and Watercare, every day they go out and get a clean set of overalls, just like scrubs in a hospital. We engaged external people to take the overalls away, and to clean them, scrub them up above the 60 degrees, and then return them back, which is working quite well. Our PPE supply, so before we went in, once this COVID-19 actually started, Bronwyn and I actually got together and said, right, we are going to need face masks. We worked with a gentleman, 3S Safety down in the south of the North Island, who have been fantastic. They've really started working for us to get the PPE in. So we're unable to source 700 pair of overalls. We're able to boots, masks, sanitizer, you name it. We've had it ready to go, ready for that first day back. We also thought it was very important to do a mental health check. So we're lucky enough to have mates in construction on board with the JV. And they come out, Richie and Slade were amazing. They're a part of our team. They deliver a session in our induction. They were able to actually check in, not just to deliver, see how you are, but the face-to-face contact after many, many, many weeks on Zoom, see this people's facial expressions. We concentrated heavily on our social distancing. So some would say it was a little bit militant, but we had dots on the ground and we all did a little warm-up for work. So if we touch hands, we're a little bit too close. So we did that as well. Look, we provided all the workers some kai. The first coffee shop, I think there was 160 coffees drunk in the morning session alone, so everyone was pretty happy to get back to work. But that was all part of the social distancing. In regards to our 2 occupational nurses, they were unable to sit with the workforce, broken up in their bubbles on their site, so in their individual work groups. They were able to go through the myths of what does a mask mean, what do I need to wear gloves, how do I put it on, how do I take it off. So all the stuff we've seen on telly, they were able to do the practical side of things. And then we did a session with Bronwyn and I, and Amir, and the senior leaders, the 2 project directors, of what's normal. This is normal process now. We still need exclusion zones. We still need drop zones. We still need spotters. Traffic management plans are more important now than normal. Let's get back to work slowly. We agreed on a slow step back to work. So instead of rushing straight in, we changed our methodologies. So when we're doing our hydro milling, we changed the activities to something that wasn't so complicated, just to get our subcontractors and our delivery people back up and running as well. So it was a really slow start to return to work. With our administration controls, we're able to go paperless straight away on that Monday morning. So we're very lucky to have a very good IT department, and we are a big organisation. We were able to use scan cards straight away on the tablet, so everyone coming through the gate would actually scan on, scan off, so we stopped that contact. We came up with an app on a phone called the COVID-19 Permit to Work. COVID-19 Permit has 2 reasons. The first one is for making sure that every activity is captured. So it's who's in charge, what permits, what safe work method statements needed. More importantly, can you achieve that 1 metre social distancing, yes or no? If you know, the activity does not start. It captures the time start, time finish, and any other information, and more importantly, the workers. So this was able to enable us on our project sites in the project bubbles to contact trace. So that was a good thing as well. In regards to the compliance, very much like the sign in, sign out register at the front gate and the contact tracing, we've got an app again created by our IT department. So daily pre-starts were happening as normal with the social distancing, but rather than having the pen handed around, it is again, it's scan on, I understand that. Same with safe work method statements and permits.
John, I think one of the things about the planning for this that was happening prior to a move to level 3 was to understand what were going to be the challenges for ourselves and for the workforce. So what were the things that were going to concern them about coming back to work, how they were going to work, and importantly, what was going to happen when they go home at the end of the day. So what I found with the plan that Duane was putting together, it was really focused on the worker and the welfare of the worker. So there are a couple of biggies there, things like what happens about the stuff that I'm going to be working in, where I'm going to be around other people or, you know, touching stuff, and then I go back home because people have been secure in their bubbles for a long period of time, and then they were coming out of those bubbles. What sort of, you know, what were they taking back home? So by creating the opportunity for people to come to work, they can come to work in shorts and a t-shirt, put on a pair of overalls, a pair of gumboots and gloves that are then removed and laundered for them, and they can leave those boots behind. And so then they're straight away removing that worry that home might have about the introduction of, you know, germs or COVID-19 back into the home environment. So I thought that was a terrific initiative and really a demonstration of the values. And I think that was one of the things that was really important when the plan was getting developed. What does the project stand for? What are the really important values that the project believes in? And it's about trust and respect and caring for people are 3 of the key values, and also that, you know, that one team approach of working really closely together. And in the planning for going back to work, Duane and myself and the health and safety manager for the project, we talked just about every day. You know, what are we going to do? How are we going to manage this? How will this work? And so by working really effectively together, it meant we had a really robust and solid plan that didn't get held up, you know, with the quibbling about how the wording was going to go or what was in it and so on. So, and another element that was about care is, you know, we've put in place a rule where if people come onto site, if they leave that site, they can't come back that day. And that's about, you know, not introducing contamination. But of course, one of the key things there is, well, how do I get a feed? How do I get lunch? And, you know, the obvious answer is, well, you've got to bring everything with you. But a simpler solution is that lunch gets provided every day. So that's what we decided to do on this project. So every worker gets a hot lunch brought in every day, so that they don't have to worry about food and organising all of that and having that all available. And the other really, really important part about care was that idea of, you know, it's been a stressful time for construction. We're in an environment where people around us have lost their jobs, and who knows, you know, what's going to happen. So workers have been mentally stressed over the last 5 weeks. They're coming back to work still a little bit unsure and worried about, you know, what's going to happen with their families and things. So really important to connect them to the mates in construction crew, but also really important to connect them with the leadership team. So senior leaders were out on site to provide that reassurance and let everybody know that, you know, that value hasn't changed. We are still really mindful, and our number one priority is care for the team, to make sure that they know that we've got their welfare front of mind throughout the whole thing.
Realise that we have to have sanitisation. So before anybody come back to site, every site shed, every crib room, every toilet, every facility was scrubbed from the top to the bottom under COVID-19 guidelines. And we now have a welfare officer on each site doing that every day, concentrating on the high touch areas. With our delivery drivers, we've got them come in, we do a separate process with them, and we do a DESNA. We're getting a concrete delivery to come in, we ask the concrete drivers to stay in the trucks. We use the chute and we get them in an area that's completely isolated to protect them and us to do their cleaning. Delivery drivers, we have set areas to put the delivery boxes down. The GAJV,
I think one of the things that's really quite cool that has happened in the way that we're working at the moment is the idea of having work bubbles. Yeah. So I reckon people have really, like, they've got, you know, being in isolation at home, you get the idea of the bubble. In fact, it's really good language. It's a good way to think about it. And now that's what's happening on site, is that the sites are all divided up into work bubbles. So those guys work as a team, and
there's social distancing. I mean, once we got out of our bubbles, everybody wanted to come and say hello together. Everyone wanted to embrace each other. It was just that general minding of the social distancing that was hard. I would have thought originally the overalls changing. We have a set uniform, a one family approach between Watercare and the JV. In fact, if you go into any of our projects, everybody looks exactly the same. So having people change from their pants and their shirts into a pair of overalls, I thought was going to be challenging, but they took to it like ducks to water, which was great. That was very good for us. But it was the social distancing and trying to keep people out of the job. In the morning, we said, don't get there till 7:30. And they were there at 6:30. They were revving to get back into that job. So the permanent changes will be the paperless inductions, paperless signing in and signing out, that electronic system of fast tracking. We like to be environmentally friendly, but as we all know, with health and safety, there's a lot of paperwork that comes with it. Just changing our focus of still doing exactly the same process, but having that one sign-off card was good. I think we'll take that out of it. I think improved site facilities as well with any sort of germophobic sort of thing happening. What can we do? But that sort of stuff. So, Bronwyn?
Yeah, I agree. I think they're the two key ones, is that, you know, the hygiene and the, you know, the facilities for workers. We always, you know, said that was a priority for us, but it's sort of forced that to happen, you know, quite quickly, and it's reset our thinking about what good looks like, and I think the paperless stuff is going to be a legacy forward.
We went for the glass full. We went for all the cogs inside the machine, see if we could take some out if we needed to, not to try and change people's behaviours back in. So we're going to go out there tomorrow again and walk around all the job sites, interact with the workers. We'll have the workers come back up to us and see, has the management plan worked? And then what is it going to be like in level 2? I mean, we've got some great guidance from government, CHASNZ and all sorts of stuff, but how does that fit in? I would say some things are going to be normal for us, which is the social distancing. I think people will definitely like their bubbles. I think that bubble group will, and bubbles for me is fantastic because it's an enforced exclusion zone without them even knowing it. So they'll look out for someone coming into the bubble. So there's a lot of stuff there that people are thinking normal of. And it's relationships, mate. It's using your eyes, your ears and your mouth. It's listening, talking and observing. There's no rocket science to it. It's coming together as an ideas. It does start at the top. It's making sure that what we ask people to do is worthwhile doing. I'm not just doing it for the sake of doing it. And my favourite saying, more doey, less tooey. I learned that from over here.
The thing that's made us able to get to this stage so effectively has been because we've worked together on it. And also, what I think is really important is that the plan was all based around people, and it's about care for people. So what the plan was around, how do we keep our workers safe? It was genuinely, what do we need to do to make our environments as safe as we possibly can for our workers and for their families? And so when you come from that perspective, I think people engage and they'll forgive you for not having everything 100% shiny and magic and super duper, but they know that at the heart of it you care about them and you want to do your best for them. I think when the plan is built around that, then it's going to be successful.